Hello and welcome back to Patient Knowledge. My name is Dr. Kirmani, and this channel is all about health education. To my new viewers and subscribers, I would like to mention that on every weekend I upload new videos related to various health topics. If you like my videos, subscribe to my channel and also share to as many people as possible to spread the awareness. And today I will be talking about an important element and an essential electrolyte, potassium. I will be telling you about its deficiency. So, have you been feeling tired and weak lately? Do you get muscle cramps and spasms quite often after a workout? Have you been feeling as if your heart is pounding or you're skipping a beat? Do you get constipated quite often? Well, do you know these could be signs of potassium deficiency? There are many more that I would like to share with you. So, let's get started. In this video, I will be talking about some of the important functions of potassium, health benefits of potassium, will tell you about the causes of potassium deficiency, what are the symptoms one should look for, and how to manage it. At the end of the video, there's a list of foods which are rich in potassium, so stay till the end. To begin with, let's look at what potassium does to our body. It's an essential mineral and an electrolyte which is vital for good mental health. It lowers your pulse rate, it maintains the elasticity of your arteries, protects you from stroke, kidney, and protects your heart. It's good for reducing inflammation. Well, the important functions that potassium performs is muscle contraction, normal functioning of your heart, and along with sodium, it regulates our water balance. Here are some of the health benefits of potassium. It eliminates the salt sensitivity of our body, thereby reducing the blood pressure. Also reduces the risk of stroke to 27%. It prevents kidney stones and another condition called osteoporosis, which is a condition that affects the bones. It Osteoporosis is a condition where we lose bone mass. It becomes soft, thin and brittle and can be broken easily. Talking about the causes of potassium deficiency. Well, there is a myriad of causes ranging from our diet to the illnesses that we get, uh, to some of the health conditions that can lead to potassium deficiency, and there are certain medications that can cause potassium deficiency in our body. Talking about the diet, more and more people prefer processed food over fresh fruits and vegetables. Well, this can deplete potassium from our body. Drinking too much water can cause flushing out of potassium. People who are under stress release a chemical in our body called cortisol. So, high level of cortisol is responsible for potassium deficiency. During vomiting and diarrhea, one loses a lot of water from the body along with important electrolytes. This can lead to potassium deficiency as well. People who have chronic constipation use laxatives a lot. Well, this can cause potassium deficiency. Those who undergo a surgery, such as major abdominal surgeries, or those who have some kind get some trauma, are on certain medications to lower the acid production in the stomach. People with diabetes and malabsorption conditions, and those who are on medication such as diuretics, steroids, or medication given to lower the blood pressure, develop potassium deficiency. Here's a list of symptoms of potassium deficiency. There's a plethora of symptoms that indicate there is less potassium in our body. So, have you been becoming more forgetful or confused lately? Do you feel very weak or tired all the time? Do you get muscle cramps and spasms quite often, especially after a workout? Is your blood pressure and blood sugar raised recently? Do you get heart palpitations such as pounding of your heart or skipping a heartbeat? Have you been constipated or bloated recently? Do you feel that your body is swollen due to water retention, such as swelling of the ankles or overall swelling of your body? Do you get joint pains frequently? Or do you feel pins and needles and numbness anywhere in your body? Well, these are some of the symptoms that of potassium deficiency. Well, if you've got any of the above symptoms, or if you are on any other above medication, you could be having potassium deficiency. So, what to do next? How to fix it? Well, there are ways to fix this deficiency easily. The first thing is to see your doctor because your doctor knows you very well and your health condition. So, he'll review your medication, and in case any of the above medication you have been taking will be replaced by another one. Your doctor may advise a blood test just to check the levels of potassium in your body. The worst thing would be to take over the counter supplements. So avoid taking any of those because they contain very minimal amount of potassium, which is not sufficient to um, make up the potassium deficiency. Well, lifestyle modification would be ideal, starting with your diet. So avoid any processed food. Any packaged, bottled, or tinned food should be avoided and replaced with freshly made home food or any fruits and vegetables. Avoid stress if possible by practicing meditation and yoga. Avoid drinking too much of water as it flushes out potassium from your body. And include potassium rich foods in your diet. Here's a list of potassium rich food. The recommended daily intake of potassium is 4700 milligrams, which is quite high. So, it is recommended to take a variety of fruits and vegetables and other potassium rich foods because many people believe that just eating a banana is enough to compensate or to bring up the potassium levels to normal. Well, that's not true because banana has got a very minimal amount of potassium. Instead, there is a whole list of potassium rich foods which will help to improve your potassium levels in the body. Avocados, potatoes, sweet potatoes, leafy greens such as spinach, kale, and lettuce should be included in your diet. Beans, carrots, green peas, mushrooms, beetroot, beet greens, oranges, and bananas are some of the sources of potassium. Well, the others are fish such as tuna, salmon, egg, dairy such as yogurt and milk, oat cereal, oatmeal, nuts such as almonds, walnuts, and roasted peanuts are good or an ideal for an ideal snack. Seeds such as sunflower, flax, and pumpkin seeds, and of course, coconut water has got a very high concentration of potassium and should be replaced with water. People with kidney disease are usually advised not to take high potassium foods because it damages the kidney further. It doesn't mean that you shouldn't be taking potassium at all. Well, if you're suffering from any kidney problems, there's an other option available which has got low potassium. Before starting these, always consult your doctor if you have any kidney issues. So here's a list of low potassium foods which are ideal for kidney patients, such as broccoli, cucumber, radish, zucchini, celery, onion, eggplants, carrots, cabbage, berries like raspberries, strawberries, blueberries, apples and pears, pineapples, peaches, and grapes. So include them in your grocery list to improve your potassium levels. That's all for today. Thanks for listening. I hope this information regarding potassium was useful in understanding everything to do with potassium, its deficiency, and how to manage it. If you wish to hear something about, leave it in the comment box below. Bye for now.